Kimani Githuku live from Olkalau for more updates. Kimani, what are we learning about this new satellite center?
Thank you very much. Well, as you say, this is one of the satellites which is being opened here in Nyandarua County among the 15 satellites in the country. It's aimed at increasing the collection of blood in the country. Remember, the blood collection is something key in the health sector in the country. The Kenyan country, with an approximate number of people, 50 million Kenyans, according to the WHO, is supposed to at least have 500,000 amount of blood per year annually collected. But so far, we have not yet attained that, but the ministry is working to ensure, and that's why they are here, trying to sensitize the importance of donating blood, because many Kenyans suffer as they go to the internet to try to ask for blood from well-wishers, because there's not enough supply of blood in the country. And we want to hear from Dr. Nduko to tell us today's event. Maybe we can start with the CDC. Thank you very much. Thank you very much.
Thank you so much, and thank you to KTN News. Today is World Blood Donor Day, and we are very excited to have Nyandarua County hosting this function today. Yes, indeed, blood is a very essential commodity when it comes to saving lives. Blood is a medicine that is used routinely, but also in times of emergencies. And I must say, as a country, we are especially proud under the stewardship and leadership of our Cabinet Secretary, Motai Kagwe. We have been able to transform and reform our blood services. As we speak today, and we are quite excited, one, particularly because almost each county in this country, we have 36 counties that now have satellite centers for collecting blood. And that is why we are here today with the governor for Nyandarua County, because we are here to celebrate him investing in putting together a blood satellite unit that will serve Nyandarua County residents. Additionally, nationally, all our regional centers are now active and functional. We have 6 of them. And one of the things we are very proud of as a Ministry of Health is that for the first time since independence, since 1963, we were able to collect close to 270,000 units of blood. It's never been done before since independence. And so there's a lot of reforms. The reforms are working. They're bearing fruits. Just last year, 282,000 Kenyans were able to benefit from blood services. And when we look at our capacities in the whole country, we've more than doubled our capacities of storing blood. We used to be at 24,000. Now we have 50,000 storage capacity. When we look at our testing capacity, again, we used to be at close to about 200 tests that we could do a day of pints of blood. Now we're almost at 3,000. So the journey really has been a tremendous journey through the service of Dr. Nduko and her team working at the Kenya National Blood Transfusion Service. A lot of improvements have been done. And today, I'm quite happy because with the governor, we've been able to tour his satellite center. And his satellite center is even able to separate blood. So we now have 16 counties that are able to take the blood that you donate to us, and we're able to separate it to ensure that that 1 pint you give us can actually serve 4 Kenyans. And so Kenya really has redeemed itself when it comes to blood, and I think we're quite excited and very happy. And today, it being World Blood Donor Day, we're here to celebrate donors. All the Kenyans, you can see behind us, we have the NYS team who is here, we have students who are here, we have members of the public who are here today, all of them coming to donate blood and save lives. And remember, Kenyans, 1 pint of your blood saving 4 lives. It's remarkable, really. And I'm quite proud, I must say, of Nyandarua County and the investments that have been put in here.
Asante Waziri. Governor.
Yes.
Hongera sana, mnafanya kazi nzuri. Mnafanya nini kuhakikisha mnaimarisha
Kwa Kiswahili? Thank you very much. I want to appreciate this partnership between County Government of Nyandarua and the Ministry of Health, led by the CAS here, Mwangangi Mase, and CS Motai Kagwe, Senator. We are putting 15 million as a county, and they have been able to support us, the ministry, with the fridges and other equipments, and more are coming in to support this partnership. Before then, we used to get blood from the neighboring Nakuru all the way to Embu and other parts of this country, including Nairobi. But as of now, we're able to be self-sufficient. And I can assure you that, going forward, we are going to engage in a major campaign to ensure, one, we are self-sufficient, and number two, able to feed other counties with blood. This is because Nyandarua County is not any other county. This is where independence was won. Our parents shed blood for this country, and we are not shy to continue to save lives of Kenyans as the patriots who have been able to fight for independence and been able to move the way we have been able to move as a county, supporting other counties as a food basket for this country. So we are used to sacrificing ourselves. We are serving 700,000 population in this county. We'll be saving mothers who come here to deliver children. Some have been dying. Now we'll be able to save lives, accidents, burns, cancer, and so on and so forth. So these are landmark. These are game changer, not only for the county but also for the region, where we'll be able to serve our people. We have recommended, as we discussed with the CS here, the issues of digitizing the entire system, so that as a nation we're able to manage blood provisions more efficiently. And secondly, is it possible to go through household motivations, incentives, so that people are able to donate blood? And once the household has donated blood, then when they go to hospital with a card, they are not asked to go and contribute blood, so that we have donors, willing donors, who are able to contribute blood not only for their families but also for posterity and for the rest of the society. And as we have been told, blood has several uses, so that will be a game changer. Then lastly, is it possible to get the youth to run this program, to manage this program, and whatever proceeds we get, so once you sell plasma, it's possible that the young people can benefit from those proceeds. They can engage in sports and talents, and and also education, scholarships and so on, bursaries. So we'd like it to be also, because the youth are the major contributors of blood, so we'd like to see some direct benefits as we come up with incentive packages. And I want to appreciate the blood center institution led by Duko here, and of course my must say, who has come to support us as a county. We will continue working together. We have done more than 22 new hospitals here. We have a new mortuary, modern state-of-the-art mortuary here. We have a state-of-the-art 500-bed capacity here, Mashujaa complex, and we have a scan machine that is already here, the kidney management here. People don't have to go out of the county. And we also have Engineer Hospital coming up with a 300-bed capacity that we are conducting with the President Uhuru Kenyatta, and it's been done by the DOD, by the Department of Defense, and many other institutions. Many labs have been put up in this county, and I'm sure 8 theaters have already been constructed. And as I've said, 22 new health facilities since I became governor. We have put in 434 new medical staff, including doctors and specialists. We have locum programs that never used to be here. So we are specialists who are able to come and provide specialized. We have also requested for support to remove the asbestos. As you can see, lots of asbestos in this county, and also the cancer management in this county is becoming a challenge that we like to work together with the national government to address that challenge. So health is priority number one in this county. Thank you.
Thank you very much, Governor. Maybe we can hear from Dr. Nduko. You have been the front line in this campaign for donation of blood. Which measures are you putting to ensure many people have been fearing to donate blood because of certain needs? Maybe you can tell us what you are doing in that department.
So thank you very much. First, I just want to really take this opportunity to thank my ministry for the support the ministry has given from the Cabinet Secretary. I want to also extend thank you to the Governor of Nyandarua, because we are here for the purposes of having been able to get a satellite running. What are the steps that we are doing? I think the first thing, and the question that has always come up, has been the question of, accountability for blood. So as you're all aware, we promised Kenyans that we would be doing a digital system that would be able to track blood from the point at which it is collected through to the point at which it is given to a patient for transfusion. I want to say that digital app is up and running. In fact, I want to take this opportunity to invite every Kenyan. Please go to MOH portal, MOH Health portal, and when you are there, that is the same platform against which you registered for Chanjo, or Chanjo sends you messages from. Please look, you will see Damu KE. Damu KE is a digital platform. It is where you can immediately go ahead and register either as a blood donor or a blood ambassador, and we'll be able to reach you. So that kind of accountability is very key for making sure we're moving forward. But I also think that the bigger issue is the question of donation, and we need more and more young people to come out and donate. We need more and more Kenyans to come out and donate. And as I always say, for every one of us who has been given a year of life, celebrate by giving back 1 unit of blood. It will save somebody else's life. Thank you.
Thank you very much. Well, you have heard it, and the theme of today being donating